I'm now going to move on to Laura. We have, as Jim will talk to us at the end, there's a few opportunities to get involved, and there'll be various ways to get involved. But Laura is going to talk about an opportunity that's coming up, kind of that we're looking at right now. So over to you, Laura.
Thanks, Sean. Okay. Yeah, so I've been a researcher at the Integrative Epidemiology Unit in the University of Bristol for the past 11 years. My research focuses mainly on obesity and obesity-associated diseases such as type 2 diabetes. But in addition to my day-to-day research, I also look after several legacy cohort studies. So you'd be forgiven for wondering what is a legacy cohort study. So I'll just try and explain that in a bit more detail first. So these are studies that were typically initiated several decades ago and were generally designed as prospective studies. So the studies that Gareth mentioned, where we're going to follow people across, a relatively long period of time to try and understand the differences in terms of, how different things that happen in their life then affect their later health. But because these studies started a long time ago, many of the original participants are now very elderly, or if they sadly died. And for this reason, there's no ongoing direct contact with the participants themselves. But the data that was collected remains extremely valuable for us as researchers. And so we want to keep this data safe. We want to keep these studies going so that they can continue to be used. And it really can be enhanced then also by combining the data that was collected during the clinic visits that the participants did with health and administrative data that's collected, for example, by NHS England. So if we combine those two data sources, we get a really valuable data set that can be used to answer many different research questions. And what's really exciting about these studies is that we have the opportunity to look at really quite early life exposures, so things that happen during childhood, and their impact right up until the end of life, so right up until that person dies, because we have that full breadth of information available to us. And so that makes these studies really exciting from a research perspective, because if you're a researcher, it's unrealistic to expect that you can in your lifetime have one of these studies. You can't follow a study for that long individually, but we have these resources already available thanks to researchers who have gone before us. Okay, so some of the studies that we're looking after at the moment are listed here up on the slide. So I'm not going to talk through all of them in detail. Some of you might recognize some of them. So the one at the top, the Caerphilly prospective study. So this was a study of men who lived in Caerphilly and surrounding villages in South Wales and who were middle-aged at the time of recruitment, which is between 1979 and 1983. And these people were invited to come into a clinic and to some measurements were taken and some blood samples collected and so on. And then they were followed up another couple of times in the 80s and 90s with more face-to-face clinic visits where they would have been weighed and their heights done and asked questions about their lifestyle. And then also filled out some questionnaires and sent those back to the study. Caerphilly was chosen because it was thought to be, at that time, it was home to a diverse group of people with varying ages, varying conditions of health, varying socioeconomic status. So it was really kind of a valuable representative set of people for Wales at that time. And as I said, the researchers collected many different measurements, but they were primarily focused on looking at the risk factors for heart disease. And some of the early findings from this study contributed to what I guess we would think of as general knowledge now, which is around, a healthy lifestyle. If you adopt a healthy lifestyle, then that helps to prevent chronic illness. And researchers also discovered links between fibrinogen, which is a clotting factor, the kind of thickness of blood, and your risk of ischemic heart disease. The Speedwell study is essentially a sister study to the Caerphilly study, so they kind of joined up and followed similar processes in terms of the data that was collected, but this was focused on people who lived in the Speedwell district of Bristol at around the same time. And so these studies are really nice to work together because you can compare and contrast what happened in the two different areas over a similar time period. And coming back to what Gareth was saying, that's kind of part of what interests us as epidemiologists, is how different exposures can lead to different outcomes for those people in those different areas. The Christ Hospital School Study and Glasgow Student Study have really detailed growth data through childhood and adolescence, and now data going on into later life, and how healthy or not healthy those individuals were. And so the extremely detailed growth measurements in the school study have enabled researchers to develop models of pubertal growth, and to look at how your growth during puberty then goes on to influence later life health. And then finally, the Boyd-Orr study. This is a UK-wide study of the impact of childhood nutrition on later life health and development, and was actually pre-World War II. So these were children who were born, I guess, nearly a century ago now. So we have all of these studies, we have all of this data, and for us as researchers, this is a really exciting resource. But in terms of why I've come along today to talk to you guys, is that we really value public and patient input into these legacy studies, and it's particularly important for these studies because we can no longer ask our participants what they think. So we need people to act as a kind of participant voice, so that when we say, okay, we think this is a really interesting research question, we think we can answer it with the Caerphilly data, is this a good idea? We can no longer reach out to those participants and say, what do you think? I guess, as Tom, as an example, in Ausbach, he's still feeding into that study that he's part of, but we don't have that for these legacy studies. So we need to look to members of the public who can help us, and to imagine what those participants would be saying if they were able to speak. And we're interested in a wide range of views and range of people to get involved, but especially those that can be considered representative of the original participants of those different studies, maybe relatives of people who lived in Caerphilly around that time, or alumni from Christ Hospital School. So people that might have some connection to those original participants, but also just people who are interested in epidemiology and research, and are happy to share their views with us. So finally, I just wanted to talk about 3 specific opportunities, as Sian said, that we're thinking about at the moment, and we will be reaching out to people to see if anybody wants to be involved in these kind of 3 areas of our work. So firstly, we will be setting up a public advisory group to provide input into the ongoing management and direction of these studies, to help work with researchers to communicate their findings in a non-scientific way, and also to promote the studies more widely. So all of those things that kind of Becky talked about earlier, we're looking to have a group that can do that for us and can work with us to help promote these really valuable research resources and make the most of them. We're also looking to have public input into our data access committee. So this committee is made up of researchers from University of Bristol and data management specialists, and they meet quarterly to review researcher applications to use the study data. So if a researcher has a research idea or a research question and they want to use data from these studies, then they write down a description of what they're going to do, who they are, why they're the best person to answer this question, and so on. And then this committee will review those. And this includes considering whether the proposed use of data, it can be considered, is it safe? Could it be detrimental to the study? Or importantly, to the participants? Because we always need to put them kind of first and foremost in what we're doing. And finally, we would like to have public representatives as members of our steering committee, which look after our legacy studies. So this committee comprises senior academics from the medical school at Bristol. And the overarching goal of the committee is to help to make sure that we're making best use of the studies, but also protecting and respecting the rights of the original participants and their families. So yeah, if you decide to sign up to the IEU PPI mailing list that I think Sian or Jim will talk about, then you'll receive an email with more information about these opportunities. Please do get in touch if you have any questions or ask at the end of the session. We'd love to hear from you. Thank you.